What if your body has been warning you about rising blood sugar and you've been seeing the signs every day without realizing it? Many people assume diabetes only shows up in blood tests, but that's not always how it begins. In fact, some of the earliest signs can appear in a place most people never think to check: their feet. Things like slight tingling, unusual dryness, or changes in color often get ignored or blamed on aging. But here's what's surprising. According to health data, millions of people are living with diabetes without knowing it, while early warning signs are already present, and many of those signs are visible right now. In this video, you'll discover 9 silent foot signs that could signal rising blood sugar and what they might actually mean. Before we begin, I'd love to hear from you, and I personally read every comment. Have you noticed anything unusual in your feet lately, even something small? Let me know in the comments below, because sometimes your feet notice the problem long before you do. Sig 9, tingling or numbness. Let's start with one of the most common signs and the most ignored. Tingling or numbness in your feet. Many people say things like, "My foot just fell asleep. I was sitting too long." And yes, that can happen occasionally. But here's when it becomes different. When it starts happening often, without a clear reason. That's when you should pay attention. Because this can be one of the earliest signs that your nerves are being affected by rising blood sugar. Here's what's happening inside your body. When sugar levels stay high over time, it begins to damage the tiny protective layer around your nerves. Think of your nerves like wires. They carry signals from your brain to your feet. But when that protective layer gets damaged, those signals don't travel properly. They become weak, distorted. And that's when you feel tingling, pins and needles, or numbness. Research shows that nearly 50% of people with diabetes experience nerve-related symptoms, and it often starts in the feet. Now here's the important part. This doesn't happen overnight. It builds slowly, which is why so many people ignore it. A simple habit that helps: daily movement. Even a 20-30-minute walk can improve blood flow to your nerves, and reducing added sugar in your diet can make a real difference over time. But sometimes the signal doesn't feel numb, it feels the complete opposite. And that's where things become harder to ignore. Sig 8, burning sensation at night. Now here's a sign many people find more disturbing. A burning feeling in the feet, especially at night. You lie down, and suddenly your feet feel hot, almost like they're on fire. Many people assume it's fatigue heat or just being on their feet all day, but when it happens regularly, especially at night, it can be something deeper. This is often linked to the same nerve issue, but at a different stage. Instead of signals becoming weak, they start misfiring, sending the wrong messages to your brain. Your brain receives a heat signal, even though nothing hot is there. It's like a faulty alarm going off without a real cause. Studies have found that this type of burning sensation can appear years before a diabetes diagnosis in some people, which makes it an early warning sign. Now here's what can help. Hydration plays a bigger role than most people realize. Drinking enough water supports your body's ability to manage sugar levels. And adding more fiber, like vegetables, oats, and legumes, can slow how quickly sugar enters your bloodstream. Over time, this reduces stress on your nerves. And the next sign is where things shift from uncomfortable to something that can become truly dangerous if ignored. Sig 7, slow healing cuts or blisters. Now this is where things become more serious. Because this sign doesn't just feel uncomfortable, it can become dangerous. A small cut, a blister from your shoe, something minor. Most people ignore it. They assume it will heal on its own, and usually it does. But when blood sugar stays high, your body loses its ability to heal properly. Here's why. Your blood carries oxygen, nutrients, and immune cells to repair damaged tissue. But high sugar levels can damage your blood vessels. They become narrower, slower, less efficient. So even if your body has what it needs to heal, it can't deliver it properly. The result? Wounds that take longer to close, or don't heal at all. And this is where risk increases, because an open wound becomes an entry point for infection. According to health reports, foot wounds are one of the leading causes of serious complications in people with diabetes, often starting from something small. Now here's a simple habit. Take 30 seconds each day to check your feet. Look for cuts, cracks, or blisters. If something doesn't improve within 48 hours, don't ignore it, because early action can prevent bigger problems later. But not all signs cause pain. Some are visible, and many people walk past them every day without realizing what they mean. Sig 6, skin discoloration. Now here's a sign hiding in plain sight. Changes in skin color. You might notice areas on your feet or around your ankles that look darker reddish or slightly bluish. Many people assume it's sun exposure, aging, or natural skin tone, but sometimes it's a sign of reduced blood flow. Here's what's happening. Your blood carries oxygen throughout your body. When circulation becomes weaker, less oxygen reaches your skin, and that change shows up as discoloration. Think of it like this. If blood is the delivery system, your feet are the last stop, and when the delivery slows down, the signs appear there first. Some studies suggest that these visible skin changes can appear months or even years before a diabetes diagnosis, which makes them an early warning sign. You may also notice thinner skin, more sensitivity or dryness in those areas. Now here's what can help. Simple movement. Even 5 to 10 minutes of ankle rotations, toe lifts, or walking can improve circulation. And that helps your body deliver oxygen more effectively. And if you're finding this helpful so far, take a quick moment to like this video and subscribe to Senior Revival, where simple changes can lead to a powerful, healthy comeback. But now we move to a sign many people think is just a skin issue, when it's actually something much deeper. Sign 5, cracked heels that won't improve. Now here's a sign many people completely overlook. Cracked heels. Most people think it's just dry skin, weather, shoes, not enough lotion, and sometimes that's true. But when cracks keep coming back, or don't improve no matter what you apply, it can be something deeper. Because your skin isn't just affected from the outside, it's controlled from the inside too. There are tiny nerves responsible for regulating moisture in your skin. And when blood sugar stays high over time, those nerves can become damaged. When that happens, your skin loses its ability to stay naturally hydrated. So even if you apply creams, the dryness keeps returning. And over time, those cracks can become deeper, even painful. And here's the real concern. Cracks in the skin create openings that allow bacteria to enter, which increases the risk of infection. Now here's what helps. Daily care. Moisturize your feet before bed and drink enough water during the day, because hydration from the inside matters just as much. But now we move beyond the skin to something happening deeper inside your body. Sign 4, swollen feet and ankles. Now here's a sign many people ignore because it feels common. Swelling in the feet or ankles. You might notice your socks leaving deep marks, or your feet feeling heavier by the evening. Most people assume it's standing too long, sitting too much, or just aging. But when swelling becomes regular, it may be a signal from your body, because fluid balance in your body is controlled by your kidneys. And high blood sugar over time can affect how well your kidneys work. When that happens, fluid starts to build up, and it often shows up in your feet first. This is sometimes called edema, and it's your body's way of saying something isn't working properly. Research suggests that kidney-related complications are common in people with long-term elevated blood sugar, often developing quietly. Now here's something simple that helps. Elevate your feet when resting. Even a few inches can improve circulation. And reducing excess salt in your diet can help prevent fluid buildup. And the next sign is one that confuses many people because it feels like something completely different. Sign 3, sharp, stabbing, or electric pain. Now here's a sign that often gets misunderstood. Sharp or stabbing pain in the feet. Some people describe it as an electric shock, a sudden stabbing feeling, or a burning needle, and many assume it's arthritis, old injury, or joint pain. But sometimes it's your nerves sending the wrong signals. When nerves are affected by high blood sugar, they don't always go quiet. Sometimes they become overactive, firing signals when they shouldn't. Think of it like an alarm system that keeps going off even when there's no danger. The pain feels real, but it's not coming from an injury. It's coming from nerve dysfunction. Studies suggest that a significant number of people with diabetes experience this type of nerve-related pain, often without realizing the cause. And here's the problem. Many people try to mask it. Painkillers may reduce the feeling, but they don't fix the root issue. Now here's what can help. Gentle daily movement, stretching your feet and ankles, and improving blood flow. And then there's a sign many people joke about, but it can reveal something much more serious. Sign 2, constant cold feet. Now here's a sign many people don't take seriously. Cold feet. Some people say, my feet are always cold. I just have poor circulation. And sometimes that's true. But here's when it becomes a concern. When your feet feel cold even when the weather isn't, even under blankets, even when the rest of your body feels warm. That's when it may be something deeper. Because warmth in your feet depends on blood flow. Your blood carries heat throughout your body, and when circulation becomes weaker, less warm blood reaches your feet, so they stay cold. Not because of the environment, but because of reduced flow. Studies have shown that circulation problems are common in people with long-term high blood sugar, affecting how blood moves through smaller vessels. Now here's what helps. Movement. A brisk walk for even 20-30 minutes a day can improve circulation, helping blood reach your feet more effectively. And over time, that can make a real difference. And the final sign is one of the quietest, but once you notice it, it becomes hard to ignore. Sig 1. Hair loss on feet and toes. Now here's something almost no one pays attention to. Hair on your feet, or more specifically, the lack of it. Most people don't think twice about it. They assume it's normal. But here's what's interesting. Hair growth depends on blood supply. Each hair follicle needs oxygen and nutrients to stay active. And when circulation is reduced over time, those follicles slowly stop working. Hair becomes thinner, then disappears. And this often happens gradually, so slowly that most people never notice it. But it's a visible sign, a quiet signal that blood flow may not be reaching your lower legs properly. Some research has linked hair loss on the lower legs with reduced circulation in people with long-term metabolic issues. Now here's what matters. This isn't about appearance, it's about what's happening underneath. Because if blood isn't reaching your skin properly, it may also not be reaching deeper tissues. And that's something you don't want to ignore. And now that you've seen all 9 signs, there's one simple step you should take. What if your body's a 30-second check that could change everything? Here's the most important step. Take 30 seconds. Tonight. Sit down and look at your feet. Not quickly. Actually look. Check for color changes, cracks, swelling, or anything that feels unusual. Pay attention to how they feel. Any tingling, burning, numbness? Because your body often gives signals early, long before anything serious happens. And the truth is, many people don't miss the signs. They just don't recognize them. According to health estimates, millions of people are living with undiagnosed diabetes, often for years. Not because it's invisible, but because it's misunderstood. And here's the good news. Early action makes a huge difference. Simple steps like improving diet, daily walking, and checking your health regularly can help prevent bigger problems. So here's a simple question to think about. Which one of these signs have you noticed, but ignored until now? We're building a community here to support your strong, healthy comeback. If this helped you, I'd truly appreciate a like, and if you subscribe, also share it with someone you love. And join me in the next video for another simple step toward better health.